Greetings everyone, my name is Yulia Glushenko and I'm a student here at CUNY Graduate School Public Health and Policy. Today I will present on evaluating the effectiveness of tailored educational materials in enhancing patient knowledge, attitudes, and behaviors regarding the oral heart health link. So my project was guided by my mentor, Dr. Louisa Burrell, and Capstone advisor, Professor James Sherry. This presentation will cover introduction and background first, then project methods, following by results and findings, discussion and recommendations, followed by conclusion, and we will finish with acknowledgements. Poor oral health contributes to systemic inflammation that increase cardiovascular risk such as hypertension. Despite this connection, public awareness of the oral heart health link remains limited, particularly in underserved populations. So the aim of this project is to improve patient knowledge and behaviors using tailored educational materials distributed through community health centers. This project focused on the roles of the community health centers in addressing health disparities and promoting integrated health care. To address this issue, we conducted a mixed methods observational study. The intervention utilized posters and palm cards available in English and Spanish, designed to communicate the oral heart health connection in a simple and accessible format. 60 adults were recruited, of whom 47 completed pre-surveys. Surveys were administered between May 29th and June 27, 2024, capturing baseline knowledge, behaviors, and clinician feedback. The participants were predominantly Hispanic, Latino 66%, with a gender breakdown 60% female, 36% male, and 4% no response. The age distribution showed 13% of participants aged 18 to 29 years old and 45% aged 45 to 64 years old. This demographic information highlights the diversity of the target population and the importance of culturally tailored interventions. The results shows a 55% improvement in participants' knowledge of the oral heart health connection. Additionally, there was a 10% increase in behavioral intentions to improve oral hygiene. While knowledge improvements were significant, behavioral changes were less pronounced, indicating a need for sustained follow-ups and more in-depth interventions. 61% of participants reported visiting a dentist in a past year. However, barriers such as limited access to dental insurance, reported by 53% of participants, and low health literacy remain significant obstacles. These findings emphasize the structural challenges that must be addressed alongside educational interventions. In summary, the tailored educational materials were effective in raising awareness, but had limited impact on immediate behavioral changes. The key barriers include limited health literacy, lack of insurance, and systemic inequities in access to care. Recommendations to expand tailored educational programs with sustained follow-ups, to integrate oral health messaging into health center workflows to make it a routine part of care, and to address systemic barriers like insurance and literacy to maximize the effectiveness of these interventions. To conclude, tailored educational materials are an effective tool to increasing awareness of the oral heart health connection. However, long-term behavioral impacts require additional research and sustained interventions. Community health centers can play a pivotal role in reducing health disparities through integrated education and care. This work highlights the potential for health centers to act as hubs for health promotion and equity. I would like to thank my mentors, Dr. Louisa Burrell and Lauren Rapp, for their invaluable guidance. My gratitude also goes to the staff and participants at Zufall Health Center, as well as collaborating health centers that supported this project and Henry Schein Cares Foundation. Thank you all for your attention and support.